Hey, it's Dr. Jerry, and today we're going to talk about something that a lot of patients ask me about treatment on: slip disc. And the first thing we're going to break down is no, discs do not slip. So what is a disc? A disc is a movable cushion between the spinal vertebra. There are 23 of them in the spine. And most commonly we see disc problems that occur in the lower back or the lumbar spine or the cervical spine, i.e. the neck. So a disc is a fibrocartilage ring that is made of concentric circles. It's fiber on the outside, jelly on the inside, and that fibrocartilage is attached securely to the vertebra above and below, so it really doesn't slip. What happens is the disc becomes irritated, it can tear, it can herniate, or it can rupture. And we're gonna go through those right now. So the spinal disc, as we talked about, is concentric fibers with a jelly-like center. The first thing that can happen to a disc is what's called a bulge. A bulge is a bulge in the concentric fibers. It may go to the center, it may go to the right or to the left. It's kind of like a car tire bulge, so we'll keep using that analogy. So disc can bulge. The next step that can happen is a herniation. This is when that bulge gets a tear in it, and that tear may not go all the way out through the outer rings of the annulus. It's a tear through some of the concentric fibers, and that's known as a disc herniation. And a disc herniation can create pain, or it can also create symptoms of numbness, tingling, weakness. The next condition that can occur is a herniated ruptured disc. That's different from a just plain herniation. A rupture or prolapse disc involves a tear in all of the concentric rings where the nuclear or jelly material has come outside of the disc and is now into the spinal canal. It may be compressing the nerve root, or it may be above or below the nerve root, and that is a prolapse. So now that we've talked about the various conditions that happen with the disc, we're going to talk about treatment and how we treat these. So first and most importantly with any patient is a consultation where we take a complete history and assessment of the ongoing condition. We'll spend some time talking about it, and then the next step is the assessment. I'll do a mechanical assessment of your particular condition. What we want to find out is exactly what's going on, if it's indeed a disc, and if it's a disc, which direction is preferential for the treatment of it. I do a type of treatment called mechanical diagnosis and assessment. It's an ongoing examination to evaluate the patient and to find out the proper treatment to eliminate the patient's disc issues. So, the majority of discs are extension derangements. That means when a patient flexes forward or bends forward, that disc protrudes back. And about 90% of these extension derangements respond well to extension therapy. About 10 to 15% of the remaining disc derangements are flexion derangements. These are derangements that don't respond favorably to the extension protocols. And what we'll do is we'll flex the patient to help reduce their symptoms. So after we have made our assessment and treatment on the patient, and we found that the patient responds to the direction of preference, we'll send the patient home with their home instructions, and they'll perform these, and then they'll return back to the office for an assessment to see how they're progressing. Okay, so we're going to go over the anatomy. We have two lumbar vertebrae, top and bottom. In the middle, the fibrocartilage disc. It's a shock absorber. The spinal nerve root, which comes out and either goes into the arms or to the legs. And when this occurs with the disc, this bulged herniation or rupture, what happens is that posterior lateral segment of the disc becomes torn, the material comes out into the spinal canal, it herniates, or ruptures comes into proximity to the nerve root, and that can cause pain, or compression to the nerve root, which not only can cause pain, but can cause numbness, tingling, or even weakness in the upper or lower extremity. So now I have a representation of a small model of a cervical spine vertebra, but the same principles apply. So you can see when the disc is irritated or herniated, it comes out into the spinal canal, and it can be anything from a simple irritation to a full-blown herniation compressing on structures. And in the cervical spine, the patient may have neck pain, or with compression, they can actually have arm pain, numbness, or tingling. So another common misconception, other than do disc slips, are, I have a disc herniation, I need surgery. Well, that isn't the case. In fact, in the lumbar spine or the lower back, only about 3% of discs actually require surgery. The vast majority, 96 or 97% of discs, can be treated conservatively without surgery. The reasons, and the only reasons for a patient to have disc surgery are the following. Number one, they have what's called intractable pain. That's 10 out of 10 pain. They can't get comfortable. They cannot sleep. They cannot function. Number two is very significant neurological deficits. They have trouble walking. They lose strength in their legs or their arms, their hands or their fingers. Number three is they lose control of urination or bowel movements. Can't control stop, start urine or fecal material. And the last thing is they've failed with conservative treatment. If you aren't in any one of these four categories, then surgery probably isn't indicated in your case. Like always, if you have a question, a concern, send me a message, hit me up on Instagram. We'll try to answer it best we can. If you have a subject about a video you'd like to see, send me that as well. Talk to you soon.